Good afternoon. It is August the 4th, 2023, and I am Dr. Wolf, a pathologist. In fact, right now I am currently inside the morgue. Not performing an autopsy at this moment. That's going to occur in a little bit. But let's talk about brain-eating amoeba. In the last couple of weeks, we've seen stories like this in the news. That this is a 2-year-old Nevada boy who may have contracted it at a natural hot spring. That's from July 22nd. And this article from yesterday, August the 3rd, young girl dies after swimming in a lake. So should you be concerned? So how concerned should you be? Well, first of all, these are rare cases. There's only been a couple of hundred cases in the last 40 years, but among those cases, only 4 people have survived, and the ones that survive are usually left with significant disability. So this disease is contracted when water goes up the nose forcefully, such as diving or swimming in a lake or pond. And what happens is the amoeba gets inside of the nerves of the nose, those nerves that help us with our sense of smell. And they will actually travel upward along those nerves into the brain. Once they get access to the brain, then they actually destroy the brain tissue. Now, the classic scenario is a pond or a lake in which there is stagnant or non-flowing water, and typically in warmer climates. So these are often reported in the south of the United States, but there have been cases as far north as Minnesota. As the temperature gets warmer, then those northern climates will probably see more cases of this amoeba. So this is a picture of the amoeba. You can see it at the tip of the black arrow. The rest of the cells in this image are actually inflammatory cells. So symptoms usually start something like 1 to 10 days after exposure. They involve fever, loss of coordination, loss of consciousness. So ultimately, what this organism causes is a meningoencephalitis, which means it is inflammation of the lining of the brain as well as the brain tissue itself. And the survival rate is low because there aren't really good drugs to treat this, and by the time you get severe symptoms where you present to the emergency room, a lot of brain tissue has already been damaged. I'm going to show you a quick video of a scenario that I saw on TikTok that the first thing I thought of was brain-eating amoeba. So if you watch that clip, he jumps into the slide and enters that water at a high rate of speed where the water would be coming up this way, and that lake is clearly stagnant. So that's the kind of scenario I would worry about. And inhaling water into the nose in any fashion is what you want to avoid. So the moral of the story is be careful if you're in stagnant water.